and good day everyone. We are the group Fun Present. May I introduce myself first? I am Duan Junel Adriano, and our topic for today is all about dimension of development, first aid education. Our learning objectives. At the end of this chapter, the learner is expected to explain the meaning and principles of first aid education, hone and apply first aid skills during emergency situations, and participate actively in the delivery of first aid services. Our first topic is all about first aid and first aider. So what is first aid? So first aid is the immediate treatment using available facilities or materials and given to an injured or ill person while waiting for medical assistance to arrive. It includes either emergency measures for life-threatening condition which requires further medical attention or care for less serious injuries which may be adequately treated on the spot. So in other cases, first aid consists of the care provided to someone with a minor injury. Like for example, minor burns or cuts. So ang first aid, it is important tool in quickly responding to accidents to ensure that injuries can be efficiently and promptly dealt with before a trained medical professionals arrives to administer more specialized treatment. So the purpose of first aid education is to minimize injury and future disability. From the word itself, first aid, it means paunang lunas. Kumbaga, nagbibigay sila ng paunang lunas upang magbigay ng kaginhawahan sa pasyente or biktima upang hindi ito gaano pang lumala, or should I say bringing them to ease and to prevent any further discomfort to the patient or victim. So the next one is the first aider. So first aider deal with the whole situation involving the patient and the injury or illness. The Philippine National Red Cross PNRC is a voluntary humanitarian organization that conducts training for people who like to become a first aider. So ang first aider, sila yung nagbibigay ng paunang lunas sa isang biktima. Ang mga first aider ay hindi basta-basta lamang first aider. Sila ay nag-undergo sa isang training kung saan sila ay tinuruan ng tamang paglalagay or tamang first aid sa isang biktima or pasyente. Like sa CSPC. CSPC as it owns Red Cross organization kung saan involved ang mga students. Sila ay nag-undergo sa isang training and seminar kung saan tinuturuan sila ng tamang gawi at tamang pamamaraan kung paano magbigay ng first aid sa isang biktima. So, ang PNRC naman, the Philippine National Red Cross Organization, sila ay nagkakandak ng training sa mga gusto or aspirant to be a first aider. So, the next one is the characteristics of a good first aider. So as a first aider, you must be gentle, resourceful, observant, tactful, sympathetic, counseling, and respectful. So as a first aider, you should maximize the use of material in hand. Kumbaga alam mo kung paano to gamitin at paano sila mailalagay sa isang biktima. So as a first aider, you know how to improvise and how to assess the situation and the victim properly and exhibit professionalism. So as a first aider, alam mo kung paano humanap ng way to provide or improvise things na pwedeng makatulong sa'yo upang magbigay ng first aid sa isang biktima. And you as a first aider, you should conduct professionalism sa harap ng maraming tao. Moreover, he or she must not cause further harm by making the victim panic. Kumbaga, ikaw ang magbibigay ng ease sa isang biktima at huwag kang magbibigay ng panic reaction sa kanila. So the next one is the roles and responsibilities of a first aider are as follows. So since the first aider does not perform the function of a doctor or compete with the latter, he or she immediately transfer the medical task and care of the victim to a qualified physician who comes to the rescue. So, as a first aider, hindi mo pwedeng akuin ang buong responsibilidad, lalo na kung yung biktima ay nasa severe situation na. Kailangan mo itong ibigay sa mas professional na tao upang ito ay mabigyan ng tamang lunas. So, number 2, he or she ensures the safety of bystanders. Bystanders meaning is yun yung mga witness or audience sa nangyaring insidente. So as a first aider, hindi mo sila pwedeng palapitin sa nangyaring insidente dahil it may cause harm to the victim or pwede pang madoble ang nangyaring insidente. Number 3, he or she assesses the condition of the victim. So as a first aider, kailangan mong malaman yung kondisyon ng biktima upang ito ay mabigyan mo ng tamang lunas. Number 4, he or she identifies the risk or threats to the victim's life. So, as a first aider, alamin mo yung sitwasyon ng biktima, alamin mo yung mga risk or threats ng buhay ng biktima. Number 5, he or she calls for medical assistance as needed. So, kung halimbawa yung na-encounter mo is malala yung nangyaring insidente, you should call medical services upang sila ang tumulong sa iyo sa pagbibigay ng lunas sa biktima. Number 6, he or she provides the immediate and necessary care. So, as a first aider, you should provide the immediate care or immediate first aid to the victim. So, alimbawa kung nalulunod siya sa tubig, you should make or you should conduct a CPR. Should I say, para magkaroon siya ng maginhawang paghinga or airway. Number 7, he or she assists the medical personnel. So, as a first aider, need ka ng medical personnel upang ikaw ang maging assistant or maging alalay upang ito ay tulungan sa gagawing paglunas sa biktima. Number 8, he or she records the situation, care given, etc. So as a first aider, need mong i-record lahat ng nangyari. Dapat alamin mo yung buong nangyari at syempre, yung binigay mong lunas or care given to the victim.
Good day, everyone. My name is Kirby G. Bernaldez, and today, in this report, I will be discussing and elaborate on the general direction for first aid. This lesson focuses on the key considerations and actions required by the first aid responders. and I will also provide further explanation and example to help you better understand this concept. A first aider may encounter a wide range of emergency situations, and his or her decisions and actions depend on the circumstances that cause the accidents or sudden illness. These actions depend on the factors such as the number of persons involved, the immediate environment, and the availability of medical assistance, emergency, equipment, and help from others. The first aider needs to adapt to the situation at hand and improvise as necessary. As a first aider, you may find yourself in various challenges or challenging situations where na dapat kailangan yung pagkakaroon natin na thinking critically and quick decisions and the actions we take. Kasi this can be a matter of a life and death. So your approach should be adaptable and responsive to the circumstances that you encounter. So the ability to adapt to the situation, sabi nga, at hand and improvise when necessary is very crucial for effective first aid provision. The first aider should keep two fundamental things in mind. One, he or she must determine the best way of rescue, such as removing the victim from water, fire, or a place filled with carbon monoxide or smoke. Number two, he or she must ensure that the victim has an open airway and must administer mouth-to-mouth or mouth-to-nose artificial respiration if necessary, including controlling severe bleeding. So here, as a first aider, your primary responsibilities or your fundamental priority are to assess the situation and determine the best way to rescue the victim. This might involve actions such as yung removing the victim from water, fire, or a place filled with carbon monoxide or smoke. But keep in mind, guys, that the specific actions you take will depend on the following factors. Ayun na guys yung sinasabi ko kanina na yung first is yung cause of emergency. So, identify what caused the accident or illness. Is it a fire or a water-related incident or exposure to smoke or carbon monoxide? Number two, the number of the person involved. Ito yung pag-assess natin on how many or ilan yung affected in the situations. You might need to prioritize your actions based on the severity of injuries and the number of victims. Number three is immediate environment. Considering natin, dapat natin i-consider is the environment around you. Is it safe for you to approach the victim? Or is there a risk of further harm? Number 4 naman is yung availability of medical assistance and equipment. Yun yung pagdedetermine natin whether professional medical help is nearby and if you have access to emergency equipment supplies. So, example for this is yung notable example for this is if someone is trapped in the burning building or a house, the first aider should prioritize safely evacuating them from the premises. So, the safety of the rescuer and the victim should always be a top priority. In terms of maintaining an open airway, so this is the second fundamental task. This is to ensure that the victim has an open airway. If necessary, the first aider should administer mouth-to-mouth or mouth-to-nose artificial respiration. So, for example, if someone has stopped breathing in a situation, the first aider should perform CPR, or also known as cardiopulmonary resuscitation, to maintain the oxygen flow of the victims. So another to keep in mind that yung the first aider should prepare to control severe bleeding, which could be a life threatening. So if someone has a deep cut, if may deep cut siya in his arm and it's bleeding extremely, the first aider should apply pressure to the one with the clean cloth or bandage to the top of and to stop the bleeding. So unless it is safe to do so, the victim should not be moved at once. He or she should be kept in the position best suited for his or her condition or injury. The victim should not be allowed to get up or walk around. So avoid as a first aider, avoid moving the victim unnecessarily, kasi in most cases the victim should not be moved unless it is safe to do so. So moving the victim prematurely can worsen the condition of the victim, or it can exacerbate injuries. If someone has fallen from a height and there's a possibility of spine or neck injury, so it's crucial. So napaka-importante to keep the victim still until professional medical help arrives. So the victim should be kept in a position that is most suitable for their condition or injury. Example, if someone is experiencing chest pain, they should be encouraged to sit down lang and lean forward slightly to ease their breathing. So as a first aider, you should have the basic knowledge on how to manage the victim's conditions, how to help them, how to help them minimize the possibility of getting hurt. So the victim should not be allowed to get up or work around. So yun nga. So as this could worsen kasi their condition or injuries. Example, if someone has sustained a leg injury, so they should remain still and not attempt to walk on the injured limb. So next slide. So the first aider in turn is not expected, however, to remain in charge until the victim can be placed in the care of qualified persons. For example, a physician, an ambulance crew, or a police officer. The victim can take care of himself or herself, or the victim can be taken by care of relatives. Above all, the first aider should know the limits of his or her capabilities. She must make minimal effort to avoid further injury to the victim and his or her attempt to provide the best possible emergency first aid care. So yun, knowing your limits. So while providing first aid, it's very important to know your own capabilities and limitations. So your primary goal is to help stabilize the victim until they can receive care from qualified medical personnel. So if example nito is if you lack the necessary training and equipment to address specific injury. So if you lack the knowledge to help the victim, your role is to provide basic assistance and ensure the victim's professional help arrives. And if the ambulance arrives naman at the scene, the first aider naman should provide the medical professionals with all necessary information and let them take over the care of the victim. Excuse me. So yung in terms of self-care naman, so if the victim can take care of themselves or has relative present who can provide assistance for the first aider, so the first aider should step back. If a person who has fainted ngaya, for example, tapos nag-regain na yung consciousness niya and is stable na siya and may malay na, they may not require ongoing first aid assistance kasi meron naman relatives around them. So knowing the limits, so the first aider should recognize their own limitations. It's important not to attempt it's important not to be stubborn. It's important not to be cocky. It's important not to make unwanted actions or behavior or heroic actions that could unintentionally harm the victim. Kasi as a first aider, your priority always is to keep the victim in safe place or place. So meanwhile, the proper first aid measures should include standard and specific techniques that have been taught in a view of circumstances that appear to be necessary. So the effectiveness of first aid measures relies on adhering to standard and specific techniques that have been taught and applying them judiciously based on the circumstances at hand. So class, remember that yung ultimate goal ng first aider is to provide the best possible care while minimize ng first aider yung risk of further injury to the victim, like maintaining open airways and controlling the bleeding. So that's the very important na as a first aider. Always act in the best interest of the victim, yon, and when in doubt and when you lack knowledge, try to seek professional medical help promptly. So first aiders naman must always operate within their scope of praxis and knowledge to offer the best possible emergency care in a given situation. Proper training and familiarity with standard specific techniques are vitals for success in this role. So remember, every act of first aid can make a life-saving difference. Thank you for listening.
Magandang umaga, ako nga pala si Alvin Iriquentina at ang pag-usapan natin ay Basic Life Support and Chain of Survival. Life support is a series of emergency, life-saving procedures that are carried out to prolong the life of a victim is classified under three types. Basic life support is an emergency procedure that consists of recognizing respiratory or cardiac arrest, or both, and the proper application of cardiopulmonary resuscitation or CPR to maintain life until a victim recovers, or advanced cardiac life support can be administered. Advanced cardiac life support is the use of special equipment to maintain the breathing, and the blood circulation of the victim. Prolonged life support is the post-resuscitation and long-term resuscitation. Long-term resuscitation is an active process of resuscitating someone or something, a medical that act or an instance of reviving someone from apparently death or from unconsciousness. And post-resuscitation care is meant to optimize ventilation and circulation, preserve organ tissue function, and maintaining recommended blood glucose levels. And next is the fourth type of chain of survival. The first one is the link of early access is initiated immediately after the patient collapse. It is initials calling the local emergency number as quickly as possible and giving the hotline as much vital information as you can about the emergency. Based sa aking pagkakaintindi, dapat may isang nakasave sa ating mga cellphone at least isa o dalawang emergency hotline number in case of emergency need ay mabilis lang natin silang makontak at ma-guide tayo paano masagawa ang first aid sa taong na-aksidente o may sakit. Next is the second link of early CPR is initiated while waiting for the arrival of emergency medical service or EMS personnel or trained to provide care. CPR can save lives as first line response that can help save someone's life in emergency. This technique aims to keep oxygen moving to vital organs. The third one is link of early defibrillation is most likely to improve survival. It is the key intervention to increase the chance of survival of the patient outside without hospital. And the last one is link of early advanced care is provide highly trained EMS personnel and paramedic who monitor the patient closely on the way to the hospital.
Hi, I'm Carla Jane Andrada and I'm going to talk about what is an emergency. Emergency is a sudden, unexpected, and urgent event. We have three main types of emergency. Number one, human-caused emergency. For example, crime, war, and terrorism. Okay. Number two, natural emergency. A natural emergency is caused by a natural event. For example, an earthquake, volcano eruption, and typhoon. Okay. Number three, technological emergency, caused by technological failures or accident. For example, power plant failures or dam failures. Okay. Once an emergency occurs, it requires immediate action or medical attention. Dahil kung hindi agad ito maagapan or naagapan, it may cause a serious danger to health or impairment of bodily function. Okay? Impairment means weakening the function of the specific body part. For example, nagka-earthquake and then may patient doon na nagkaroon ng injury sa left leg dahil nadaganan ng mabigat na object. Okay? And nabigyan agad siya ng medical assistance or attention, and after a few weeks or months, naka-recover siya from that injury. Okay? And nailalakad na niya yung legs niya, pero hindi na normal. Okay? Kumbaga, pilay na. Kailangan na niya ng support like tungkod. Okay? And ayun yung impairment. Okay? Nabawasan yung ability ng legs niya na mag-function normally. Okay? And if the patient's leg lost the ability to function normally, okay, matatawag na yung patient as disabled. Okay? That's all. Thank you.
A pleasant day, everyone. I'm Gian Balbes, and I will discuss the Emergency Action Principle. Emergency Action Principle. The scene must be surveyed entirely. To activate medical assistance, the first aider can do care first or call first, especially in cardio-related problem, adult, and care first. And in respiratory problem, first and infant, bystander can be requested to call a physician. Take note of the following in activating medical assistance. Number 1, situation of the person injured. First, so dito po kailangan na malaman mo muna or i-check muna kung ano yung sitwasyon ng person na na-injured kasi kinakailangan malaman kung safe ba yung tao or yung na-injured. Number 2, location of the accident. Basically po, kung saan nangyari or naganap ang aksidente, kailangan din natin itong malaman. Number 3, number of person injured. Kailangan din malaman ng isang first aider kung ilan yung mga taong na-involved sa isang aksidente. Number 4, extent of injury and first aid given. Kailangan din malaman kung gaano kalawak ang na-injured and also kailangan din malaman kung ano yung first aid na binigay sa na-injured. Number 5, telephone number from where you are calling. And lastly, number 6, identify of the person who activates the medical assistance. Dito kailangan malaman kung sino yung gumawa ng medical assistance sa person na na-injured kasi kailangan malaman kung saan siya nakapagtapos magsagawa ng medical assistant if there any problem that the person injured. For primary survey, check the airway for breathing for 5 seconds and blood circulation for 10 seconds. Secondary survey involving interviewing the victim, knowing her name, background information about the accident, assessing sample medical history of the victim illness, last oral intake, and event prior to the accident. To check the vital sign, the first aider must determine radial or carotid pulse, bleeding, and the examination must be conducted. This will enable the first aider to see if there is temerity, contusion, abrasion, puncture, burn or bleeding, tenderness, laceration or swelling, or DCAP-BLTS. Emergency rescue is the quick transfer of a patient from an unsafe place. So, dito po pinag-uusapan ng mga action na dapat gawin sa emergency rescue. Tulad po ng kung paano natin aasikasuhin ang mga taong nangangailangan ng rescue at kung paano natin sila matutulungan. Sa emergency rescue naman po, sila naman yung magta-transfer ng na-injured sa safe na lugar. The indication for emergency rescue are, number 1, danger of fire or explosion. For example po is bursting of firecrackers. Number 2, risk of toxic gases or asthma due to lack of oxygen. Number 3, serious traffic hazard. Number 4, risk of drowning. Number 5, danger of electrocution. Number 6, danger of collapsing walls. So, ito pong number 1 to 6 is kinakailangan ng emergency rescue.
So, good morning everyone. My name is Melvin B. Boreta from BSc 1A. Now, we will discuss about methods of rescue and methods for transfer. Methods of rescue. For immediate rescue without any assistance, drag or pull the victim in the direction of long axis of his body, preferably from the shoulders. If possible, minimize lifting or carrying the injured person. Before checking the injuries, unless you are sure that there is no major fracture or involvement of his neck or spine. Most one-man drags or carries and other transfer methods can be used as methods rescue. Factors that determine the methods of transfer. Number 1. Nature, the severity of injury. Number 2. Size of the victim. Number 3. Physical capabilities of the first aider. Number 4. Number of personnel and equipment available. Number 5. Nature of evacuation route. And number 6. Distance to be covered. And last, which is number 7, sex of the victim. Pointers to be observed during transfer. Number 1. Victim's airway must be maintained open. Number 2. Hemorrhage is controlled. Number 3. Check the victim's condition regularly. Number 4. Supporting bandages and dressing remain effectively applied. Number 5. The method of transfer is safe, comfortable, and as speedy as circumstances permit. Number 6. The victim's body is moved as one unit. Number 7. The taller first aider stays the head side of the victim. Methods of transfer. One man assist, carries, or drags. Assist to walk. Carry in arms. Saddleback carry. Back strap carry. Fireman's carry. Blanket drag. Shoulder drag. Feet drag. Methods of transfer in terms of two-man assist or carries. Assist to walk. Four-hand sit. Hand as a litter. Chair as a litter. Carry by extremities. Methods of transfer in terms of three-man assist or carries. Berries alongside narrow alley. Number 2. Hammock carry. Methods of transfer in terms of one-man assist or carries. Blanket, shirts or coat, empty sacks. Emergency action principle. Survey the scene. Do primary survey of the victim. Activate medical assistance. Do a secondary survey of the victim.
Good day everyone. I am Daniela Caabunita and I will discuss about bandages and bandaging techniques. So, bandages and dressing are both use in wound or fracture management. A bandage is a piece of cloth or other material used to bind or wrap a diseased, injured, or fractured part of the body. Usually shaped as a strip or pad, bandages are either placed directly against the wound or used to bind a fracture of the body. So, yung bandage po, ito yung piece of cloth na color white na usually ginagamit sa emergencies like sa sugat or pilay natin. Kapag napilayan ka, tinatali ito sa part kung saan ka nagka-fracture. Ginagamit po ito para mas maiwasan na mas ma-damage yung fracture na meron tayo and para po mas ma-prevent yung any bacteria na pwedeng pumasok sa sugat natin. And here's some bandages and bandaging techniques adapted from Survive Outdoors. Bandaging upper and lower extremities. Shoulder bandage, yung sa shoulder po natin. Elbow, yung sa siko. Hand bandage, yung sa kamay. Leg, upper and lower bandage. Knee bandage, and foot bandage. And syempre po, dapat tama yung pagkakalagay ng bandage sa sugat o kaya fracture natin because if hindi po, it's possible na mas ma-damage or mas ma-harm yung fracture ng isang pasyente.
How to apply a cravat bandage to the shoulder or armpit. First step, make an extended cravat bandage by using two triangular bandages, then place the end of the first triangular bandage along the way of the second one. Then, fold the two bandages into a single extended bandages. After the second step, fold the extended bandages into a single cravat bandage. After folding, secure the thicker part overlap with 2 or more safety pins. Fourth step, place the middle of the cravat bandage under the armpit so that the front end is longer than the back and the safety pins are on the outside. Then, cross the ends on the top of shoulder. The last step, take one end across the back and under the arm on the opposite side and the other end across the chest. Then, tie the ends.
Hello, my name is Jerus Nixon Awa and I am going to demonstrate how to apply a cravat band to the elbow. Common injuries to the elbow can be a fracture of the bone, a dislocation, or even an inflammation. And in most cases, these are caused from excessive physical activities or accidents. The most applicable first aid material that can be used is a cravat band as it serves as a support for the elbow to stay in place while waiting for a proper medical treatment. In applying the bandage to the elbow, you need to first bend the arm and place the middle of the cravat at the point of the elbow, bringing the ends upward. Make sure that the elbow of the patient is fixed and is in a comfortable position. And then you need to bring the ends across, extending both downwards. Lastly, take both ends around the arms and then tie them with non-slip knot at the front of the elbow. Take note that if an elbow fracture is suspected, do not bend the elbow. Instead, bandage it in an extended position. So that's all on how to apply a cravat band to the injured elbow.
Angela May Salazar Abale, and I'm here to demonstrate how to put a hand bandage. To apply a triangular bandage to the hand, step 1. Place the hand in the middle of the triangular bandage with the wrist at the base of the bandage. Step 2. Place the apex over the fingers and tuck any excess material into the pleats on each sides of the hand. Step 3. Cross the ends on top of the hand, take them around the wrist and tie them with a non-slip knot. To apply a cravat bandage to the palm of the hand, Step 1. Lay the middle of the cravat over the palm of the hand with ends hanging down on each side. Step 2. Take the end of the cravat at the little finger across the back of the hand, extending it upward over the base of the thumb, then bring it downward across the palm. Step 3. Take the end under the thumb and across the back of the hand, over the palm and through the hollow between the thumb and palm. Step 4. Take the ends to the back of the hand and across them. Then, bring them over the wrist and cross them again. Step 5. Bring both ends down and tie them with a non-slip knot on top of the wrist. This is the step on how to put a hand bandage.
In this video, I will demonstrate the leg upper and lower bandage. Place the center of the cravat over the dressing. Take one end around and up the leg in a spiral motion and the other end around and down the leg. Bring both ends together and tie them with a non-slip knot.
At this video, I will demonstrate if how to apply cravat bandage to the knee, and I will show the technique in bandaging the elbow. Here's the procedure. So the rationale of using an cravat bandage around the knee is to maximize the cutaneous contributions to joint position since through cutaneous sensation from the area around the knee.
So what I'm gonna demonstrate in here is on how to apply a triangular bandage to the foot, or on how to apply a foot bandage. Number 1. Place the foot in the middle of the triangular bandage with the heel well forward of the base. Refer to figure 9A. Then, ensure that the toes do not come in contact with the absorbent material to prevent chafing and irritation of the skin. Number 2. Place the apex over the top of the foot and tuck any excess material into the pleats on each side of the foot. Refer to figure 9B. Number 3. Cross the ends on the top of the foot, tape them around the ankle, and tie them at the front of the ankle. Refer to figure 9C, 9D, and 9E. That would be all. Thank you.
I'm Hanfei A. Bungalay, and let's proceed to the conclusion of the dimensions of development of first aid education. So it is an imperative that first aid or the immediate treatment of ill or injured person be learned by everyone since accident happens anytime. Yung pagtulong natin sa ibang tao kapag may nakikita tayong mga na-aksidente. Then, serious attention and readiness must have demonstrated by any individual who wishes to learn and readiness of first aid. She must demonstrate that by any individual who wishes to learn the readiness of first aid. Yung tamang proseso kung paano tayo tumulong sa taong may aksidente. A first elder may encounter different problems in the performance of her duty. He or she must remember that his or her decision and active participation depends on the involved, the immediate environment, and the availability of medical assistance, emergency equipment, and help from others. Kapag wala pa yung mga ambulansya or the professional nurse something, kapag nasa streets tayo, yun, kapag tayo nakakita ng mga aksidente, we can help from them by our own knowledge to paano pag gumawa ng mga bagay tulad ng mga professional, pero in a simple way. Yun yung pagtulong natin, yung pag first aid, the bandage, yung parang ginamit, at yun yung process kung paano natin tulungan ng mga tao. A good first aider must have a strong desire to help the victim. Ito yung makikita natin na kapag may na-aksidente, una mong iisipin yung tulong na agad dun. Hindi yung sa ibang tao na pupuntahan pa, lalapitan, pipicturean pa. Hindi naman makakatulong yun sa pagtulong ng isang tao na aksidente. So, next. He or she should act carefully and make quick and wise decision depending on the condition of the injured person. Yun, hindi ka dapat magpapanik. Kung different, kung may dugo na ba, marami ang dugo na lumalabas. Dapat, mas pinapakita mo sa sarili mo na dapat mas malakas ka kapag ito na aksidente. Bakit? Papakita ba natin na mas panic tayo sa nararamdaman nila? Na wala na silang possible na kamalay-malay kasi hindi na nila alam kung ano nangyayari. Tapos, kailangan bigyan natin sila ng isang parang magpapakalma kung ano nararamdaman nila, magpapakalma in a term na kailangan natin isipin kung wag na muna natin sila i-pressure kung sakit ba, sakit ganun. Kailangan natin isipin muna kung ano magpapakalma sa kanila kapag ganun ang sistema kapag nagkakaroon ng aksidente. Dapat tayo ay mas malakas kaysa sa mga na-aksidente pa. The first aider needs to adapt the situation at hand and improvise as necessary. Yung pagtulong natin sa ibang tao na may aksidente yun ngayon, nakita natin in a proper way kung tayo nakakita, kailangan natin gumawa ng paraan. We have to pay attention kung paano natin matutulungan yung tao. Pero kailangan pa natin magpatulong sa ibang tao na mas may kakayahan at may karapatan gumawa nun. He or she should also know the limits of his or her capabilities and should apply minimal efforts to avoid further damage of injury to the victim. So yun nga, kapag tumulong tayo in a simple way, kailangan natin ipakita na dapat may karapatan din yung mga tutulong. Kaya yung sa ambulansya, kapag pumunta na sila, ikaw pwede kang magtulong in a simple way na ikaw yung unang nakakita, pwede mo siyang tulungan, pero ipapahandle mo na siya sa mga professional which is alam nila kung anong dapat gawin na mas marami pang ayusin pa sa mga aksidente. Kaya yung pagtulong natin, yun yung unang lunas. Kaya yung sabi na first aid, unang lunas. At ang susunod na ay yung mga professional nun. Then, kailangan natin ingatan ang isang pasyente kapag nasa unang lunas pa lamang siya. Kailangan yung mga bagay na yung mga equipment na ginagamit talaga in a first aid, kung ano available, kung t-shirt ba or something mga tela. Basta matapaan yung unang sugat niya or even kung marami siyang sugat, dapat doon tayo sa mas bleeding part and most important part na dapat hindi ma-damage. So that's all for today's video. Thank you for listening from us presentation and hope you learned something from us. Thank you.